Good morning, everyone. Thank you all for being here today. My name is Will Flanders, and I'm the Research Director at the Wisconsin Institute for Law and Liberty. I also want to thank Speaker Voss and Senate President Felzkowski for speaking on this important issue this morning. We're often told that Medicaid expansion is the right move for our state, that it will reduce our uninsured rate and provide critical health care to those who need it most. But when we examine the numbers, the reality is far different. Our research, which we have here today, shows that expanding Medicaid would have almost no impact whatsoever on our uninsured rate. In fact, less than 1/10 of those currently uninsured would become eligible for care under expansion. And if every single one of those individuals enrolled, our uninsured rate would drop by just about 0.36%. That's barely a dent. By comparison, Oklahoma and Missouri, that expanded Medicaid in 2021, saw their uninsured rate drop by 2.1% and 0.8% respectively. Clearly, Medicaid expansion is not a silver bullet for those of us in Wisconsin. And for such minimal returns, we have to ask ourselves, is it truly worth the cost? With $36 billion in federal debt and growing every day, there are serious discussions going on in Washington about whether we need to be making cuts to Medicaid and other programs to live within our means. The Medicaid program cannot be immune from those discussions. Currently, states are reimbursed up to 90% for their expansion population, which fall between 100% and 138% of FPL. That's the federal poverty limit. However, Congress is discussing equalizing payments between expansion and traditional Medicaid populations, in effect shifting much of the burden of expansion back to the states. If that happens, we have to be prepared for the consequences. What would that actually mean for our state? Well, the numbers are actually pretty staggering. If the federal reimbursement rate for Medicaid expansion drops to 50%, which is one of the things that's being discussed in Washington right now, our Medicaid expansion would cost us an additional $154 million per year, and that's the net. That's after the new money that comes in. We'd be in the hole about $154 million per year. And that's a price tag we simply can't afford. It's such a bad outcome that there are 9 states, including Illinois, which is obviously a more left-leaning state, that have included triggers in their Medicaid expansion to undo Medicaid expansion if these changes were to come into place. Supporters argue that expansion would also provide a short-term financial boost. That's the $1 billion that the governor, $1 billion plus the governor has talked about. But under a 50% reimbursement scenario, that money would be completely exhausted in just 9 years. And that's if no additional spending was put on the books. We know the governor has discussed how he'd like to spend that money as well. Whatever benefits there have been in the past for Medicaid expansion, the train has already left the station. Medicaid expansion is not free money. It's a costly gamble with little reward in our state particularly. The financial risks are real and the benefits are minimal. We must ask ourselves, do we want to commit millions to a program that could leave our state on the hook for hundreds of millions in new costs, all for a mere fraction of an improvement in our uninsured rate? Moreover, Medicaid expansion is likely to raise costs for private payers as well. Our nationwide analysis, again in the study that we released today, found that private healthcare costs on average were about $215 more per person in states that had expanded Medicaid than those that hadn't, and that included a bunch of control variables that you'd find in traditional social science analyses. This makes sense intuitively. Healthcare providers make up for lost revenue for Medicaid patients somewhere. Even if they're a nonprofit, they have to at least break even essentially in resources. And private payers are the only option left on the table when we expand the Medicaid population. Wisconsinites are already worried about the cost of healthcare, and shifting additional costs to patients will only make matters worse. Medicaid expansion has never been a worse idea than it is right now. Wisconsin is right to have rejected this plan in the past and is right to reject it going forward. We don't want to put private payers on the hook and Wisconsin taxpayers as a whole on the hook for millions of dollars in more spending. At that, I'll turn it over to Speaker Voss to discuss it further.
Thanks, Will. Good afternoon. Thank you very much for being here today. Once again, Wisconsin has made the right decision by not expanding Medicaid. Wisconsin did a unique thing by actually making sure we'd have no coverage gap in our state when Governor Walker was in office, and we have kept funding that ever since. So just a quick reminder for those people who are watching that don't quite understand all the details. Right now in Wisconsin, if you are at the federal poverty level or below, you are already automatically covered by Badger Care or Medicaid. What folks would like to do is to take the individuals who right now qualify for the exchange or Obamacare for free, and instead of having them take private insurance, paying private rates when they go to the doctor, they would like to shift them over to this Badger Care system, which pays significantly less than the market rate. So for those of us, like myself, who offer insurance to our employees, it means that the more people who go on to the government system, the more the private system has to make up the deficit between what's covered as a percentage of reimbursement and what's not. So by keeping the expansion from happening in Wisconsin, we have had no individuals or almost none who don't already have access to health care, but we have ensured that we don't increase the cost on the private sector. Wisconsin has done a good thing in light of what's happening with the federal government right now. You can be a Democrat or a Republican, but everyone has to recognize the long-term fiscal stability for our nation is at risk because of the massive deficit that's been run up under both Republicans and Democrats. Somebody has to finally fix it, and every program is going to have to change if we're going to do it. So I have no doubt that as the federal government looks at it, they're going to look for ways to save money in every program, as they should, going after waste, fraud, and abuse. My hope is that instead of focusing on expanding government-run health care, we try to find ways to make sure that the private sector is more competitive, and hopefully we root out the waste and inefficiencies in our own system in Wisconsin, ensuring that people who need the health care continue to get it. So with that, I'll turn it over to my colleague, Senate President Felzkowski.
Thank you, Speaker. And again, thanks for being here today. You know, I did 4 terms on the Joint Finance Committee recently, and in the last 2 terms, I had the honor of working on the DHS budget, with Medicaid absolutely being one of the largest. Keep in mind, 30% of our budget overall, all funds, goes to Medicaid. We are very committed to making sure that the most vulnerable in our state are covered by insurance. But as the Speaker said, putting people off of health insurance and onto Medicaid is not the way to do it. Now, right now, we are looking for the upcoming budget, our cost to continue under Medicaid. All the benefits that we currently offer people is $1.6 billion. It is a huge portion of our already existing budget. Medicaid expansion also, when we look at it, it takes resources away from their most vulnerable population. In states that have Medicaid expansion, the population states, in expansion states, spending on children, the disabled, has stalled, while the spending on the able-bodied adults has grown. So this is not what we want to have happen in Wisconsin. It's the exact opposite. In non-expansion states, spending on children and the disabled has grown by 1/3 more than in expansion states. So states like Wisconsin, we are funding our priorities, taking care of our most vulnerable. Think right now, we get approximately a 62-63% in our FMAP, the money that we pull down from the federal government. Let's say they cut that by 3 percentage points. You're talking hundreds of millions of dollars. Hundreds of millions of dollars that would have to be made up at the state level. By not taking the Medicaid expansion, those are dollars that are being saved. But there's something else. 74.3% of doctors and facilities out there accept new Medicaid patients. 96.1% accept fully insured patients. So how are we doing a service by taking people off of fully insured plans and putting them on Medicaid? We are limiting their access. And now say you're in crisis and you can't get to that doctor. Where are you going to go as a Medicaid patient? Because we can't get you to appointments. Nobody's taking new patients. You're going to go to the emergency room because you have to have care. Where is the highest cost to deliver care? In an emergency room. And what's your continuity of care? You're at an emergency room doctor. You might get an immediate relief, but where now is that continuity of care in the long run if you can't get to a regular doctor to be seen, and now move up the chain through specialty doctors? So by pushing Medicaid expansion, you're doing a disservice to the most vulnerable population by putting them into a system that has a lower quality of care, potentially. So it's not helping the most vulnerable. Kaiser Family Foundation reviewed over 600 studies on Medicaid outcomes, yet only 20% examined actually found health improvements by shifting people onto Medicaid. Among those, just half found any positive impacts. Medicaid expansion is not the way to go financially, and if we really care about the Medicaid population. Thank you.
Happy to answer any questions.
Yeah, we're going to start taking questions.
Rob, I had a question. So this morning you said you want to do $2 billion for prisons. You said before about $2 billion in tax cuts. Cost continues $1.6 billion. With a $4.3 billion surplus and $1.85 billion in revenue. At least $550 million ballpark figure for schools, universities, government operations, everything. Or are you gonna borrow for the prison? How does it all work financially if you don't do the expansion with the cost of continuing?
Sure. Well, I mean, part of that's going to work our way through the entire budget process, but that's why we think it's so important for us to set the table for what is available for us to invest in whatever program it would be. Medicaid, obviously schools, whatever the corrections program is going to be, and that's why we would hope to get an agreement on our tax cuts first, so we know what that number is, and then we work our way backwards. What happened last time around is it was an amalgamation of all the process together, where the big spending increases occurred, as Governor Evers requested, largest increase in investment in schools, largest increase of 20-year history for nursing homes, lots of good things that happened. And at the same time, Governor Evers vetoed 95% of our tax cuts. So, fool me once, shame on me, fool me twice. So that's where we are. So we just got to make sure that we know the amount that we can invest before we begin to have the totality of the discussion.
Speaker Voss, under Chase Sortwell, under the umbrella of the GOAT committee, has been requesting information from local governments around the state about their DEI initiatives.
Yeah.
Can you provide any insight into why GOAT has decided to focus on DEI at the local government level as seemingly its first act as a committee?
I don't think it's the first act. You'd have to check with the chairman, Wesky. And I think part of the challenge that we have is we have had a very hard time getting cooperation from the administration. We all know, and you all know, an open records request, there's no timeline to have it fulfilled. So I think part of the discussion is to say, are there grants that are going to local governments that have requirements in them that add extra cost or extra burden that we could look to say we're not going to allow that to happen? I think part of the challenge is trying to get to the root of the problem. We do not have the same access as what's happening at the federal level, where they have people way smarter than any of us with technology and able to get access to those. We don't have the same access granted by Governor Evers, so we have to use other methods. So you should talk to them about the details, but I think that's the goal, is to try to make sure that whatever we are rooting out for waste, fraud, and abuse, we have data to be able to utilize, and it's just hard to get from an administration that's uncooperative.
He started sending these requests, Democrats in the committee say without their knowledge, and before the committee has even met. Do you know of any mechanism or concern that he is doing this under the guise of the committee without going through the formal motions of engaging, with the committee process to actually go out to start to request this information?
Well, it's pretty normal to do fact gathering before you have a hearing. So, I don't know what agreement he has between the chair and the vice chair, because obviously he's the vice chair of the committee. Right. So I think they are attempting to find the information to make sure as we go forward it's relevant. I think that's good. You don't want to just have a hearing with no agenda. You want to be able to try to utilize all that. So my hope is that we see what they find. I don't know why anybody would be concerned. I mean, I am the subject of open records requests at least weekly, right? It's not always the funnest part of your job, but it's part of what makes Wisconsin government open. So we have to do that. So for local governments to say they don't want to comply, no matter what it is, they have to follow the law. And the law says that if you have records that are responsive, you have to give them to whoever it is, especially the legislature, as we're doing our due diligence.
The House resolution that passed last night, obviously this has a framework, right? Doesn't have details, but in looking at the committee that oversees Medicaid, for example, it tells you, or says, we're going to cut this much for that committee.
Well, no, reduce the increase.
Yes, so there's assumptions to be a cut of some kind, right? Reduce the increase. Are you guys bracing for reduction in Medicaid dollars to the federal government with what is going on with the House resolution, or
no, I mean, absolutely not.
Really cushion this budget?
No, I mean, so let's just remember, first of all, now again, it's only press reports, so I'm not 100% sure that everything is accurate, but it sounds like the House budget resolution reduces $2 trillion in spending over the course of the next decade. So when you look at that as a percentage of the total government spend, it is a small fraction of what they need to do to even come close to balancing the budget. I think what we also know is there is fraud and abuse inside the Medicaid program. I mean, even here in Wisconsin, I have been told, and we are doing part of our research, that there is not as vigorous a process to qualify folks who are on Medicaid to make sure they are actually allowed to be on it, as opposed to we wish they could be. The second thing is, and we have passed it in Wisconsin, I hope the federal government gives us the tools to do it, I think we should have a work requirement. I think we should say that if you are able-bodied in Wisconsin, you should not be allowed to rest on the laurels of someone else's hard work when they pay taxes, right? You should have the help when you need it, but you should be able-bodied off to work. So I think a lot of the savings that we're going to see will not just be from reductions in future increases, but they'll be from making the program more efficient. People who shouldn't be on there, making sure they're off. People who are ineligible because they should be able-bodied, hopefully doing the same thing. Anything else you want to add?
Well, I would also say, too, I think it's about protecting benefits for those that they're intended for. If we have waste, fraud, and abuse, those are dollars that aren't going to people that they're intended for. I mean, elderly, blind, and a lot of our elderly, blind, disabled people, the people that are deserving of these dollars and that they're intended for, if people are abusing the system, we want to make sure that we're rooting that out, and the dollars will be there long-term for the people that actually need them.
Speaker Voss, you just mentioned vigorous process for Medicaid. Can you talk a little bit more what you mean, like what you're looking into in that?
Sure. If you remember, I don't remember if it was the last session or the one before, we passed legislation which would have asked the Evers administration to apply for work requirements for Medicaid for Badger Care. Governor Evers vetoed that. So my hope is we now have the ability to put that as part of our negotiation, either in the budget process or perhaps as part of the national bill that the Congress moves forward, for them to look and say work requirements for able-bodied citizens, broadly supported by the public, regardless of party. And one of the things that I help builds confidence in the system. Look, if someone is hurt or disabled or infirm, I think most Americans would say we want that person to have access to the benefits they need to make sure they can, go to the doctor and be able to have a reasonable life. But if you're able-bodied and just living off the hard work of someone else, I would also hope most Americans could look and say, well, that's also equally wrong. So why Governor Evers vetoed that years ago, super disappointing and surprising, but I shouldn't say surprising. It's not surprising, unfortunately. But that's one of the things that my hope is that we can have this vigorous discussion to say, look, even with our cost to continue, as Mary mentioned, it's $1.6 billion. It is a huge increase in existing Medicaid spending. Well, if we're going to do that, I hope we can find some reforms in the process too. We can't have an open checkbook with unlimited ability to have the state of Wisconsin pay because our resources are not infinite. So I hope we can find that.
Anyone else? Great.
Have a
Thanks,
great
guys.
day.
Appreciate
Thank
it.
you.
Thank you.
Thank you.